Hi everyone, my name is Abby Geiger and I am going to be talking about thyroid cancer today. This is a diagnosis download for APTA Oncology Student and New Professional Subcommittee. So let's go ahead and get started and jump in. So to start, I'd like to talk a little bit about our thyroid, what it is, and then get into what thyroid cancer itself is. So your thyroid is a gland that is in the front of your neck, kind of around your throat and your trachea. And your thyroid produces a bunch of different hormones that are going to help us regulate different bodily functions. These include heart rate, blood pressure, body temperature, and weight. Your thyroid is also involved in development when you are younger too. And so as you can see in the picture, that red circle is kind of circling your thyroid so that you know where it's located. And this means that thyroid cancer itself is going to be cancer that starts in the cells of the thyroid. This is most commonly going to be follicular cells. Next, let's talk about some risk factors of thyroid cancer. So it occurs more often in women than in men, and exposure to high levels of radiation can be a risk factor from things such as an occupational hazard. And then inherited gene mutations can also predispose individuals to developing thyroid cancer in their lifetime. And I also just wanted to note that having a healthy weight and maintaining that healthy weight across your lifespan can reduce the risk of getting thyroid cancer both in men and women. So some common signs and symptoms of thyroid cancer. It's important to note that it can often be asymptomatic, especially in the early stages. You can develop a lump on your throat as well as swollen lymph nodes around your neck. You might get pain in your neck or your throat, and along with that, difficulty swallowing or voice changes can develop as well. So treatment options for thyroid cancer, surgery is an option as with a lot of cancers. So you can have a thyroidectomy, which is taking out the entire thyroid, or a lobectomy, which is just one lobe, as well as lymph node dissection, which is common with other types of cancer we've discussed in the diagnosis download. So we already know a little bit about those lymph node dissections. This is typically going to be cervical lymph nodes, as those are the ones that will be affected in this area. Thyroid hormone therapy is also a treatment option, especially for those people that do undergo a thyroidectomy. And then radioactive iodine is also a treatment option, and this can actually require a significant quarantine during it because of the radioactive nature of the iodine. I actually evaluated a patient who was going to be heading into that treatment, so I got to learn a little bit more about it. And then there are also different options like radiation, chemotherapy, and targeted therapies. As far as clinical implications, focusing more so on therapy and rehab's perspective, thyroid cancer itself might present similarly to other head and neck cancers. It's not classified as a head and neck cancer, but since your thyroid is located in your neck, a lot of the same impairments can develop. And especially since we already talked about the lymph node dissection, that's kind of where those two overlap, because both head and neck cancers and thyroid cancer might involve a lymph node dissection in the treatment. So there's risk of developing neck lymphedema after the lymph node dissection. They can also have difficulty swallowing and or speaking, impaired soft tissue mobility, especially after radiation as scar tissue forms and those soft tissues change. And then it's also important to note that when you have surgery in the neck, it's a small area. Sometimes our spinal accessory nerve can be damaged or intentionally or unintentionally, and that can lead to shoulder dysfunction, which is also common in other head and neck cancers as well. So, physical therapist role in thyroid cancer. So first, I think screening is a really important role. So always being aware to screen for associated signs and symptoms and looking out for any red flags when you're evaluating any patient. And then also just promoting an annual physical exam with their primary care provider, especially for something like this that may be asymptomatic. I think routine checkups are really important, especially as we go through life. I think next, let's talk about referral. So, some things we talked about, such as difficulty swallowing, we might not be able to address in our scope of practice, but it's really important for us to identify this time to refer outside to a different healthcare professional who might be able to help them address this impairment. And then intervention. So, our job, we can identify and treat those impairments from thyroid cancer or the treatment itself, and find the ones that we can address and help improve their quality of life by addressing those. That might be lymphedema or the shoulder dysfunction or neck mobility. And then also education. I think that with cancer and oncology itself, education is always going to be really important, and promoting physical therapy from diagnosis through survivorship to improve quality of life and outcomes where appropriate in these patients. And then also just educating all of our patients as well on the importance of physical activity and wellness, and how those can kind of be modifiable risk factors for a lot of different diseases. So we'll wrap up with this slide having our 4 major takeaways. So although not classified as a head and neck cancer, thyroid cancer can cause similar impairments. And then lymphedema and musculoskeletal impairments that arise can be managed with physical therapy. And refer to a speech-language pathologist for any speech or swallowing dysfunctions that you see in these patients. And finally, just advocating for lifelong physical activity and maintaining a healthy weight to decrease the risk of thyroid cancer. All things that we touched on, but things that I just wanted to point out again that I think could help you if you were to run into a patient with this diagnosis. And then this slide has all of my resources that I use to kind of put this diagnosis download together. If anyone has any questions or suggestions or any further information about this, feel free to reach out to me because I'm always open to learning more myself too. Okay, thanks everyone.